So my name is Dana Lake. I
Mm,
am a D4 in dental school right now.
My
okay.
name's Abigail Vossler. I'm
Okay.
a fourth year dental student at Ohio State College of Dentistry.
I did my diagnostic wax up and
Hmm.
I probably spent
Yeah,
30
we.
hours
Oh, I
in
saw
the
that.
preclinic
That is a
lab.
pretty good wax up.
Actually, that wax up, as much as I loved it, she kind of clued me in on some functional limitations
Okay.
from it, especially with like the incisal length and how she thought, I might have some issues there.
Okay. Yeah.
So from there, she was already kind of showing me a different perspective that I wasn't necessarily thinking about, which was
Hmm.
interesting.
Okay.
Also with material thickness and just different material options I had too. Probably 6 or 7
6 years.
times.
Wow, that's a lot of
Some of
time.
them, yeah, some of them were longer, meetings than others. Sometimes it was just kind of checking in.
Hmm.
Once I'd submitted my final impressions, I went to check to make sure that everything poured up correctly.
Okay.
Um, Obviously, it's a really big case for me, so I was kind of tracking all the movement on it, and
Hmm.
seeing when things are going to be finished up, and kind of seeing her process. Part of it wasn't just getting her input about the case from my point of view. I
Okay.
also took it as an opportunity to see what the actual lab process was, all of these things that I did learn, right? But
Hmm.
it's like seeing it with my own eyes, like looking at the actual die of a crown that has those grooves. And she
Hmm.
was showed me the burr on the mill and how big it was, and just kind of making those connections
Okay.
and seeing it from, instead of looking at intraorally, right, where I can see the whole context, I can see the
Hmm.
patient's face, seeing it from what their perspective is, which is just this piece of stone right in front of them.
It was definitely exciting. It was one of the
Okay.
first our school has done.
Hmm.
And Dr. Nasani helped a lot to find a patient that was good for the case.
Okay.
And working with the lab and working with our lab tech Gretchen was really
Hmm.
interesting to see how it was all done and designed. No, that was my first time seeing it all, so it was really interesting. And
Wow.
she helped
Okay.
me. Um, she let me watch her design everything, and she showed me how she did everything and how important it was to get good margins and everything. So it's
Hmm.
really interesting.
Okay. And how was the result? Did you successfully deliver the crown?
It was very successful.
Okay.
After we milled it and
Hmm.
finished it, we placed it, and there needed no adjusting virtually, and it fit perfectly. And the patient was really happy that it was all able to be done in a day. Yeah, so it was a big case for the first time I've ever done multiple aesthetic anterior crowns.
Okay.
And I worked with Gretchen, our lab tech, to be able to understand what exactly we needed. I first worked with her to make splinted provisionals,
Hmm. Okay.
so that the patient had something that looked nice. So they were milled provisionals,
Hmm.
and that helped the patient be confident, and we kind of got an idea of if she would like the crowns and the crown shape and everything.
Okay.
And then when it came to milling the crowns, I worked with Gretchen to make sure that we had everything we needed,
Hmm.
and had a good scan of everything and scan of the RPD in the mouth with the crown preparations and
Hmm.
everything. I discussed with her at least 2 or 3 times. I was
Okay.
with her in the lab talking about the case, and I
Hmm.
also emailed back and forth with her, which was really helpful,
Yeah.
to get an idea of if we had everything we needed and what was going to be possible for her to make as well.
Yeah, absolutely. I think it really has been one of the most transformational experiences of dental school for me.
Hmm.
Just understanding, the role on the team,
Hmm.
right? Where
Yeah.
you know, and having like a true respect and reverence for the lab and how important what they do is for what I do.
Okay.
Um, and really learning, like hearing directly from her and just the other laboratory technicians as well,
Mm-hmm.
just what what is the information that you need from me for you to give me the best possible restoration back.
That's right.
Like it's just a two-way street of communication. Applying to residencies, I definitely used it as an experience that I thought would, kind of set me apart. And
Mm-hmm.
it definitely motivated me to pursue like a higher level of education. Just to all the different, talking to all the different technicians and everything. Um, and seeing all of those different people that you can learn from.
Definitely. I feel
Okay.
like it gave me more experience and insight than maybe other dental students get, to be
Mm-hmm.
able to do milling and working with labs, to do cases that hopefully I'll do again one day in private practice.
Okay.
So it was really a good experience.
So I think, way back, not knowing what I know now, right?
Mm-hmm.
I don't think that I would, necessarily understand the true value of it, like from that position of being, not even in dental school.
Mm-hmm.
Um, so that's part of the reason why I think this is so important. And I really do believe that it's by far the better choice to choose a school with an in-house lab. Um,
Okay.
Part of the learning was learning how important the communication with the lab was. I mean, that was really a huge takeaway, is
Mm-hmm.
how
Yeah.
much a case's success can hinge on that, on
Mm-hmm.
your, as the provider, your communication skills. How well are you able to communicate, right?
Mm-hmm.
Um, so I would definitely, knowing what I know now, of course, choose a school that has an in-house lab. But I think,
Mm-hmm.
as new dental students, they might not understand the importance of that, and that's something that I, think the schools should really try to push and show and increase that communication and show them how important that
Mm-hmm.
is.